Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's learn a few important questions from Pathology and Laboratory section for your 2025 CPC exam. So the first question we have is regarding drug assay. So there are more questions, like 2 to 3 questions were there from drug assay. Okay, so drug assay is very important concept. So let's see all the types of drug assay and let's understand about each of the unique test. Okay, so firstly, in the drug assay, there are 3 types. Okay, 3 types. One is the first type, we call it as screening or preliminary test. Okay, and the second one, the drug name is definitive drug test or confirmation drug test. Last one is therapeutic drug assay. Okay, so all these 3 drug assays are very important. So first one, in screening, here what they will do, they'll examine or they'll screen to just to know presence and absence of drug. Okay, you can see drug assay. The first one, set of codes. There are 3 codes: 80305, 80306, and 307, and which is for screening or preliminary test. So you can see here it identifies patient is using a drug or not. That means the presence or absence of drug. Okay, it's a qualitative test. Coming to the next set of test is definitive or confirmatory test. So here they are going to confirm the drug and also they are going to quantify the amount of drug. Lastly, therapeutic drug assay. So here performed to monitor the clinical response to known for prescribed or OTC medication. So sometimes what will happen, maybe patient will be on current medication or maybe long term medication for some medical condition. So that long term medication can affect patient in several ways. Okay, so just to know the toxicity level in blood or CNF, central, the cerebrospinal fluid, they'll take the sample and they will examine the toxicity. Okay, so that is called therapeutic drug assay. So here the first question, you can see, the a business inquires drug testing for cocaine and methamphetamines prior to hiring a job candidate. Single analysis with direct optical observation is performed, followed by confirmation of cocaine. What codes are used for reporting the testing for the confirmation? So here there are 2 tests are involved. Okay, one, you can see single analysis with direct optical observation. This is one test, and again followed by confirmation of cocaine. This is one more drug test. Okay, the first one, it belongs to screening drug assay. Second one belongs to confirmatory or definitive drug assay. Okay, so you need to take 2 codes for this scenario. So first we'll see the code for single analysis with direct optical observation. Okay, so this single analysis comes under screening test. Okay, so 80305. So we'll see the differences in that screening test first. So you can see here, the first one, 80305, says it is used to report the procedure in which results are read by direct optical observation. Okay, so the results can be visually read. That time we code 80305. And to read the result, if they utilize instrument, then we code 80306. And lastly, if they utilize any kind of chemistry analyzers to visualize the result or to read the result, see, 80307 is used to report any number of devices or a procedure by instrumented chemistry analyzers. Example, you can see EA, ELISA, and EMIT. All of this chromatography technique, all this will be included here in 80307. So coming back to the question, so if you check the screening test here, single analysis with direct optical observation. Okay, and they did not document any instrument being involved here. So the correct code for the screening test is 80305. Okay, the first code 80305 is correct. Okay, so next one, what they are saying, single analysis with a direct optical observation is performed, followed by confirmation of cocaine. So you have to go and check under definitive drug test for cocaine, because they are confirming the drug as cocaine. So you have to check under definitive drug test. So look for cocaine. So options you can see. Okay. So here it is. 80353 is for cocaine. Okay. So the correct answer for the first question is option C. 80305. It is for single analysis with direct optical observation, which comes under screening. And 80353 is for confirmation of cocaine, which comes under definitive drug testing. Okay. Answer C is correct for this particular question. So next question, patient is taking tacrolimus for transplanted organ. Therapeutic drug assay is performed to measure the concentration of tacrolimus in the patient blood. So patient is been taking tacrolimus for transplanted organ, and now they are measuring the concentration of the tacrolimus in patient's blood. Okay, all you have to do is go ahead and check for therapeutic drug assay. Under that, look for this medication, tacrolimus. So after definitive drug test, you will get the therapeutic drug assay. So you can see here therapeutic drug assay. Under therapeutic, you can check for that particular drug, whatever they are measuring the concentration. So tacrolimus, they said. So you can see here tacrolimus 80197. Okay, 80197 is the correct answer. Option D is correct. Okay, option D is correct. So next question. Patient is seen in ER and the patient has a history of depression. Drug testing confirms she overdosed on tricyclic antidepressant drugs, including doxepin, amoxicillin, and one more drug. Okay, so there are 3 drugs here which comes under tricyclic antidepressants and drugs. So this is again a definitive drug because they are confirming. Drug testing confirms. So we have to go ahead and we have to check the definitive drug class listing. Okay, so that easily we will be able to take the code. So you can see here tricyclic antidepressants they are saying. So if you go and refer the definitive drug class listing, this is the classes listing. Okay, in this table you can actually see this. See 80335 and 80337. This is the reference. So this include antidepressants, tricyclic and other cyclicals, and this includes many drug. Okay, so now look for the individual code description. What is 80335 and rest of the thing. So you can go ahead to definitive 80335. You can see. So this is the listing that we have in the table. So firstly 80335 antidepressant, tricyclic and other cyclic, 1 or 2 drug. Okay, only 1 or 2 drug. And 80336 include antidepressant, tricyclic or other cyclic, include 3 to 5 drugs. Okay, so if you check in a question, there are 3 drugs. There are 3 drugs which belongs to tricyclic and antidepressant drug. So the correct answer should be 80336. Okay, 80336, which includes 3 to 5 drugs. So we will code 80336 as the correct answer. Okay, option A is correct. So next question, one more question regarding therapeutic drug assay. So here you can see physician prescribes carbamazepine to treat patient with the epileptic seizures. After 6 months, the physician performs therapeutic drug test to monitor the total level of drug in the patient. Okay, so this pronunciation you can just check it. And here what CPT and ICD actually removed ICD code. So just see the CPT. So the CPT codes here, you already aware the drug name and they are doing therapeutic drug test. Okay, just go ahead under therapeutic lists and check for that particular drug. Okay, so they're under therapeutic drug. So here is a therapeutic drug. Look for that particular drug which we have in question. So see here 80156 carbamazepine, total 80156, and if they mention free 80157. Okay, so the correct question. So they did not mention any specification. So you can just take it as a total. Total level they have given. Okay, total level of the drug in the patient. So answer should be 80156. Option D is correct. 80156 is correct. So next question is regarding penal coding. Okay, the physician orders basic metabolic penal which includes total calcium and an electrolyte penal. So applying CPT guideline for organ or disease oriented penal, what CPT coding is reported? So you already aware of the basic coding guidelines what we have for penal coding. So let's see and let's apply the coding guideline and we'll get the answer. So this is the penal. So you can see the coding guidelines for penal here. Do not report two or more penal codes that include any of the same constituents test performed from the same patient collection. Okay, utilizing same patient collection if they are performing two different penal, but the two different penals having same kind of repetitive test. Okay, then those repetitive tests should not be built in another penal. Okay, any one penal you can code, but same kind of test with another panel you should not code. Okay, you should code them individually. So I'll explain that also. You can see if group of test overlaps in two or more panel, report the panel that incorporates the greater number of tests to fulfill the code definition and report the remaining test using individual test code. Example, do not report 80047 in conjunction with 80053. So just refer here 80047 and 80053. Okay, 80047 says basic metabolic penal, calcium ionized, and 80053 says comprehensive metabolic penal. Okay, so if they are performing for the same patient utilizing same collection, you can cross check between two panels. Okay, you just have to see is there any tests are repeated. So if you compare between 80047 and 53, there are many tests are repeated. Okay, so you can see comprehensive metabolic panel has more number of tests compared to basic metabolic panel. Okay, and you can just cross check here. So you can see first calcium. Calcium is there. Carbon dioxide, that is also there. Chloride present. Creatine present. Glucose present. Potassium again present. Sodium is there. Urea, nitrogen, that is also present. Okay, there are 14 tests in CMP and almost all the tests are already present in CMP test which are there in basic metabolic panel. Okay, only one unique test we have from basic metabolic panel, that is calcium ionized. Okay, 82330. This is the only test. We have a unique test under basic metabolic panel. So that you cannot code both penal code. Instead, you will code one penal code which is having more number of tests. Okay, so CMP is having more number of tests. So I will code 800531 penal code. And to report basic metabolic panel, as many tests are repeated, I will exclude all these tests and I will take only calcium ionized. As it's a unique test, I will code 82330. This is a unique test from basic metabolic panel. So I can go ahead and code it as an individual test along with another panel code 80053. Okay, this is how we code for panel. And now in the question, you can see the physician orders basic metabolic panel, which includes total calcium, and an electrolyte panel. So two panel. One is basic metabolic panel, which includes calcium total. Okay, so you can see under basic metabolic panel, we have two separate panel codes, 80047 and 48. One panel includes calcium ionized, and one more panel include calcium total. Okay, so you have to now refer between basic metabolic panel, calcium total, and electrolyte panel. Okay, electrolyte panel consists of 4 tests. One is carbon dioxide, chloride, potassium, and sodium. Okay, only 4 tests are there. And the first thing what we have to do, we have to cross check, is there any test is repeated? And if it is repeated, you cannot code that particular test. So you can see carbon dioxide, chloride, potassium, and sodium. All the tests what we have in electrolyte panel already exist in basic metabolic panel, calcium total. Okay, so what we can do, we cannot code here, we cannot code 2 panel. Okay, instead we will code higher number of test panel, that is basic metabolic panel have more number of tests compared to electrolyte panel. So first I'll code 80048. Okay, and to code electrolyte panel or any individual tests are there here, no individual unique tests are present in electrolyte panel, so that it is completely you can ignore. Okay, you can just code only single code, that is 80048 basic metabolic panel, calcium total, only you will code. Okay, so the correct answer for this question is option B, 80048. Okay, why? Because whatever the tests they have performed in electrolyte panel, all those tests are repetitive. All those tests already present in basic metabolic panel also. Okay, so that one single panel code is enough. So next, one more question regarding panel. Which code selection is reported for the following laboratory blood test performed? Carbon dioxide, that is bicarbonate, chloride, and sodium. So here actually they are not performing any panel. Instead, they are coding them individually. Like they are performing it in individual format. Carbon dioxide, chloride, sodium. Okay, so first you can check all these 3 tests only. This 3 tests only have any one panel name. Okay, so no, we don't have any for these 3 tests. We don't have any panel. Okay, these codes are exist in multiple panels. Okay, so what we can do here, we can code them individually. You can code carbon bicarbonate one code, and chloride one code, and sodium one code. Okay, and you can see option D has that 82374. So 82374 carbon dioxide bicarbonate, and same way the other code is chloride. So chloride code is 82435. Okay, and then lastly we have sodium, that is 84295. Okay, so these 3 codes only they performed. Okay, only 3 tests they have performed. So for these 3 tests you cannot put any panel code. Okay, so that's why you will code all these 3 tests individually. So to remember to code panel code, okay, to code final panel code, whatever the test that are listed under that particular panel, each test should be performed. Okay, so if I want to mention it as, see here, now they performed 3 tests. Okay, so 3 tests, it includes carbon dioxide, chloride, and sodium. 3 tests they have performed. But in case if this sodium, if they would have added potassium also, okay, 4 tests like carbon dioxide 1 test, chloride, potassium, sodium. If you get all these 4 tests together, then you would have assigned 80051 as your penal code, because it meets all the individual tests which are listed under electrolyte penal. But now what happened? They did not perform potassium. Okay, they did not perform potassium test. They only perform carbon dioxide, chloride, and sodium. So that you will code them as an individual code. Okay, individual test code 82374, 82435, and 84295. Okay, these three you will code. Okay, answer D is correct. And see, in option C, 80051 with 52 modifier they have given. So 80051 is an electrolyte penal code. Okay, 80051 is an electrolyte penal code. With that, they have given 52 modifier. So what you will think if you don't know the concept? If you, okay, one test they did not perform, potassium they did not perform. So I can use 52 modifier, saying that reduced service. Okay, so this is a wrong concept. Remember, with the penal code, we don't use 51 modifier or 52 modifier. Okay, we don't need that modifier here. If they are reducing the penal, then you should code them individual. Okay, so for this particular question, option D is correct. So next question. We have regarding anatomic pathology. Okay, so the question include 3 days old died in her sleep. A pedestrian determined this was a result of crib death syndrome. The parent gave permission to refer the newborn for necropsy. Pathologist receives a newborn with her brain and performs a gross and microscopic examination. Physician issues the findings and report they are consistent with the normal female newborn. Okay, so anatomic pathology is also important. Okay, so in that, what you have to see, see, anatomic pathology, post-mortem examination. First set of codes we have only for gross examination. Gross examination means only with the optical observation, and they're not utilizing microscope here. So this is the first code set. And after that, necropsy, autopsy, gross and microscopic examination. Okay, so here you can see. And they have mentioned that newborn with brain. They are performing the newborn, the baby which has died, and that particular brain, they are doing autopsy procedure. Okay, so answer is 88029. 88029 is the correct answer. You can see option C is correct. If it is infant with brain, you will select 88028. Since it's newborn with brain, as they have documented, you have to select 88029. Answer is C. Next question, again regarding anatomic pathology. 27-year-old male dies of gunshot wound. A forensic autopsy is performed to gain the evidence for the police investigation. So it's a forensic autopsy. Okay, so you can check here. So 88036, necropsy, autopsy, limited, gross and microscopic, regional. So as they have mentioned limited or regional, the meaning of that is a particular section of the body part. Say for example, abdomen. Abdomen is one region. And same way, trunk or chest. Okay, if they say like that, then you can conclude it as regional. Okay, and 88037, it's for single organ. If they are examining heart only, or if they are doing autopsy on kidney. Likewise, if they specify organ, you will select 88037. But in our question, they are performing necropsy or autopsy for forensic examination. Okay, for investigation purpose, they are doing. So you should select 88040 as your answer. Okay, so the correct answer is option D. 88040. Okay, so these are few questions. Okay, so please check, and with this you need to learn so many other concepts. Okay, so what I am sharing through YouTube is like it's a very kind of minimal. what to say, few 1 or 2 marks will be, these are definite questions, but we are not sure which set question, in that particular set question what a question you will get. Okay, but to get more knowledge and to get all the knowledge in all other concepts with practice question, please do join my live classes. Okay, and there I will discuss all the topic from the basic to advanced level with practice question. So you will be able to remember the answer also, and you'll be able to remember the concept forever. Okay, so you need to know panel coding, next drug assay and pathology consultation, urine analysis and laboratory test like urine culture, and specimens include okay, that you can leave, frozen section, cytologic evaluation. Okay, and pathology, surgical pathology include the levels. Okay, we do have surgical pathology level based on the procedure. Okay, or based on the specimen procedure. So we have many things to learn, and again chromosome analysis, what to say, we have reproductive medicine, and mm, and also growth hormone calculation, and many things. Still pathology and laboratory have more kind of section to discuss. So all the things will be covered in classes. So that's all, guys, for today, and I'll try to cover a few more concept from medicine, and maybe tomorrow or day after tomorrow. Okay, so thank you all for watching, and if you're watching this video, I'm very glad. And definitely these videos, it might be short video, but it will help you. Okay, and if you already have this question, then it will be like a reference for you. If you don't have these questions, then it isn't just for you, it's an additional knowledge. Okay, so yes, thank you all. Please to subscribe, and please to share with your medical coding friends. Thank you.